Good afternoon. I'm DJ Wells of the Urban Health Program at the University of Illinois at Chicago, and this is Urban Health Hotline, where each week you'll have an opportunity to have your questions answered about healthcare careers and opportunities, educational opportunities that are available at the University of Illinois at Chicago, and just things of interest that might be coming up in the community, especially things related to healthcare, to community access, to education access. We'll talk about a little bit of everything here on the Urban Health Hotline. Remember, it's a call-in show. It's your show. So if you have questions about anything that we're discussing, feel free to give us a call. The number is there at the bottom of your screen, 312-738-1060. And the phone lines are open now, so feel free to give us a call at any time. Today, our guest is Mr. Francisco Pena. Francisco works in the Graduate College of the University of Illinois at Chicago, and we'll talk a little bit about what that means in just a minute. But Francisco does a lot of recruiting of graduate students who have finished a bachelor's degree, and especially focuses on graduate students in the urban health program. So Francisco, thanks for being with us today.
Thank you for having me.
Well, Francisco, let's start by explaining to our viewers what it means when we say the graduate college. What does that entail at UIC?
Well, the Urban Health Program, there's currently 6 offices, and at the administrative office, we're actually the only Urban Health Program office that is located on the East Campus. A couple of things are different though, of our typical student as opposed to our colleagues in the West Campus. Our students are mostly focused on research. In fact, that's one of the big differences between being a grad student and a professional student.
Right.
A professional student is working on, they do have some academic training, but mostly they're working for a licensing, to get a license so that they can be practitioners, while our students are actually working on doing research, and the relation is more of becoming the professors of the future that will train future medical doctors and so forth down the road. One of the other main differences that we have is that, unlike my colleagues on the other side of campus, our typical graduate student at UIC is actually funded to go to school. And to define it more specifically, a grad student, by definition, is one that is either an MA, Master's of Arts, an MS, a Master of Science, or a PhD, which is a Doctor of Philosophy.
Okay, well, very good. And I'm sure that folks out there, their ears perked up when you said they're funded to go to school. So we'll talk about that in just a short while. Now, I mentioned that you do a lot of recruiting for the graduate college. So you're recruiting graduate students and specifically students in the health sciences and the other STEM disciplines. Tell us a little bit about that. Where do you go to recruit, and how do you recruit students? And perhaps most importantly, what are you looking for when you're looking to recruit a student? Because I'm sure our viewers might want to know if they've got what it takes.
Our mission with UHP is exactly the same as any of the other units on the West Campus. We're looking, as it relates to UHP, we're looking for students that are specifically African American, Latino, Native Americans that have an interest in the health sciences. We have about 7,000 graduate students currently at the University of Illinois Chicago, UIC. We are also unique, I should have mentioned this, because we're campus-wide. There's 15 colleges at UIC, so any college at UIC has a grad component to it. Like most of the large research universities that exist in the country, we bring our graduate students from everywhere.
Right.
Certainly, we see Chicago and Illinois as an area that we want to recruit from. However, we also think about it in perspectives of at the national level. We do not do international. We focus on U.S., Illinois, Chicago. What makes a good grad student is similar, I guess, in some ways to, let's say, medicine or nursing or whatever. Yes, we are looking for students that do well academically in terms of GPA and standardized test scores. But one of the things that we're actually looking for specifically also is people that actually have research experience.
Yes.
and actually have a, quite frankly, a research topic and a research question that they would like to answer, which is why they choose in many cases to do a PhD. PhD is basically you're focusing about 5 to 7 years of your academic career, basically focusing on a very narrow aspect within a very broad discipline. Right. So it's not just to say that you're interested, for example, in epidemiology, which we would have in public health, but it's specifically what area of epidemiology are you interested in? Are you interested in how it affects women, men? Are you looking at transmittable diseases in certain populations and so forth? So it actually gets very specific as to what we're looking for. And yeah, we're like any other UHP unit, we're actually looking for people that are passionate in ideally going back to their communities and using the learned skill set to better their communities in general. Right? It sounds very holistic, I know, but we do want our students to actually make the place that they came from better because of the training that they had at UIC.
Outstanding, and that is very much in keeping with the entire UHP mission. That, and we've talked about that on previous shows here. That the program grew out of a need to address the needs of the community. That health disparities were recognized in poor, urban, predominantly Black and Latino communities in Chicago, and the state legislature saw fit to create a program here at UIC to recruit students who could address those needs. And it sounds like what you're doing in the graduate college and what you're doing specifically in your recruitment efforts is finding students that can actually live up to those expectations.
Yeah, absolutely. And even though we've done great strides, we continue to exist because obviously populations change.
Yes.
Right. The number of what we used to refer to as the underrepresented, our African American, Latino populations, and even our Native populations, continue to expand, not only numerically but also percentage-wise. So it's difficult to say at what point we no longer will need a program like UHP because the need will always change as populations change across the country.
Absolutely. Now, we mentioned that you recruit, all graduate disciplines, but you focus on urban health program students, that's certainly a major part of your focus.
It is a large part of my focus, yes.
Why is that? Why specifically the health sciences?
Well, the health sciences, when you look at the UHP, the mission and the documents, the words research and teaching are very prominent in the literature that we have. It is important that we have an operation like the one that we have in graduate college that is in fact looking to recruit people that are interested in becoming researchers for the future, right? When you look at even our College of Medicine, though we do have a lot of faculty members that do have the MD, many of them in fact do have either the PhD or the combination MD-PhD, right? It's important that they be researchers.
Why is that important, Francisco? Why researchers? Isn't it enough just to have doctors and nurses and dentists and pharmacists that are of color?
We need people that are working in the creation of knowledge.
Yes.
Not just the dissemination of knowledge.
Yes.
Right. We need people that are actually out there finding, if you want to put it as in simple terms, we need people that have the potential of creating a new drug. If you become a pharmacognosy major, for example, in a graduate program, we need people that are looking for new drugs, for new challenges and new needs that might be happening. One of the things that also people learn from becoming PhDs is that they become very good administrators through time. So we definitely need to have a strong group of scientists that and I'm going to talk strictly here UHP, that not only understand what the problems are, but ideally can actually integrate our cultural needs. And by that I mean our African American, Latino, and Native American populations in not only their research but also in their practice as professionals.
Yes.
Across.
And bring those things forward in policy discussions as well.
Absolutely.
Right.
Yeah, I mean, we have an amazing PhD program in the
Yes.
School of Public Health and Health Policy Administration.
Right.
We have it because, we need it, and we UHP would be interested in that because we want a voice.
Absolutely.
An educated,
Absolutely.
qualified voice to be there.
Well, Francisco, you've been so kind to invite one of your outstanding graduate students along, and so we're going to ask him to come up here and answer a few questions about his own research and some of the things that he's doing as well. And like I said, you mentioned students in the graduate college are often funded, so we'll ask him about that. But I do want to ask you one last question before I let you go, and that is for our viewers out there. And by the way, viewers, let me remind you, if you've got questions that you want answered, please do give us a call at 312-738-1060. But for our viewers out there who might be interested in some of the things that you've talked about, what can they do? What should they be thinking about doing in their own academic and professional lives that are going to make them stand out so that when you're ready to go out and recruit, they might catch your eye?
Definitely, I cannot sugarcoat this. Do well as an undergraduate student, right? Perform. Make a sacrifice. Few people that I've met are naturally gifted. Unfortunately, most people will, in fact, have to work on a GPA and establishing a nice history of academic research, right? But I would also like to make an invitation. There are many programs that we offer, not only to graduate college, but also to the Urban Health Program, that can allow you to discuss one-on-one with people like me the possibility of UIC as either a graduate or a professional option for school.
Yes.
We have a large event coming up on April 5th, which is our African American Latino Research Forum. It's next year, Friday, April 5th. It's a collaborative effort across campuses, including Urban Health Program Central as well as Graduate College, where people can come actually see, not only hear discussion about what we do and the importance of what we do, but also get to see firsthand research being presented by our undergraduate, graduate, and professional students, right? And of course, they would have access to people like us. But I believe Urban Health Program also has two major conferences that we do every year.
Yes.
And I don't know the dates off the top of my head.
We'll make sure that that's available to folks. And in fact, let me do this, Francisco. We are going to invite your actually, before we do that, because this might be for you, we've got a caller on the line who has a question. So let's see what that caller. You had a question for us.
Hi. Good afternoon.
Good afternoon.
My question for you: you're definitely obviously reaching out to the people in the academic world, but with your research programs, do you ever reach out to people who might come from outside, like with life experience, as they might say?
I would say that across the country, this is not just true for UAC, but the idea that we recruit folks that are 21 out of undergraduate is more would be somewhat inaccurate. I like to say that at the graduate level, there is no such thing as a non-traditional student. Most of the folks that I recruit are coming in their 30s and in their 40s, right? They are people that have definitely have had the life experience, whether it be professionally or just, some people do Peace Corps, some people do many things. The road to becoming a successful PhD student is not paved in just one direction.
Absolutely.
They come from many paths.
Absolutely.
And you'll see this, the student that we will have here, he is a typical UIC graduate student in many ways, not only in his excellence and his research and his commitment, but across the board, and you'll see this in him as well. So yes, I can tell you that if you are interested, you can reach out to us, and I would love to talk to you more about UIC as a potential place for you for graduate study.
Okay, thank you.
And thank you for your call. And Francisco, let's go ahead and invite your student up. And in the meantime, there's some information there, so that and caller that was just on the line with us, if you want to reach out to Francisco and ask him more specific questions, there's information right there on how to contact the Urban Health Program, and then we can refer you directly to Francisco. But give us a call at the office, 312-996-7727, sometime after the show, and we can make sure that you get to where you need to go, and that you're speaking with the folks you need to speak to about your own professional career interests and aspirations. I'm joined now by Michael Lewis.
Oh, hello.
Hi, Michael. And Michael is the graduate student that we've been speaking so glowingly of. Michael, let's start with just some basic stuff so that folks know who we're talking to. Tell us a little bit about your background and where you're from. We were talking beforehand. I know you did your undergraduate work someplace else.
Right.
But tell us a little bit about where you're from and how you came to UIC.
Well, sure. I'm currently a PhD student. I've been at UIC before as a master's student in 2001.
Okay.
And I was an undergraduate at Purdue University.
Mm-hmm.
So in between my master's and PhD, I did some work at a small computer company in Batavia.
Mm-hmm.
And this was basically a engineering boiler company where I would simulate fluid dynamics. And I came back to UIC because I knew it was a great university, and that I already did my master's here at the University of Illinois.
Mm-hmm.
And I was coming from this department called the Electronic Visualization Lab that currently has this $1 million cave, this visualization virtual reality system.
Wow.
And so I knew I was in good hands coming back here, and now I'm working in cloud computing and working with Francisco under the Graduate College.
Outstanding. Now, you're not an urban health program student per se. You're not pursuing a specific discipline in healthcare, and yet technology has so many applications to healthcare now, and we're seeing so much of what's being done in healthcare being reliant on technology.
Yes, exactly. For me, just being in cloud computing, we had people from different health providers using large-scale distributed programs on the cloud.
Mm-hmm.
If you're not familiar with the cloud, it's this infrastructure where you have a whole massive amount of computers that collect data and computate data and do large-scale processes for your company.
Mm-hmm.
And it is very important in the health science community as well, and a lot of restructuring and figuring out how you can do distributed work on the cloud systems.
Absolutely. Outstanding. And now, I've got to ask you this, because it's so much in keeping with the Urban Health Program mission. Francisco talked about the fact that we're trying to recruit students of color here to UIC, specifically in the health sciences, but of course across all of the STEM disciplines, across all the science and technology disciplines, including medicine and healthcare. Do you see a lot of people that look like you working in technology fields? Is there a need for more folks that look like us?
No, unfortunately, there are not a lot of people like me, African American males specifically, in this program, and in specific the PhD department. If I can actually recall, I'm probably only one of the very few who actually are going for a PhD in computer science. And so there is a definite need. And like Francisco was speaking about before, is that we need people of diversity, underrepresented people, to represent the state.
Yes.
In order to represent the population and represent our group, that we could do research as well.
Absolutely.
We could do administrative jobs.
Absolutely. Now tell us a little bit about you mentioned that you were working in the industry. You had a job in the industry, and then you came back for a PhD. What are you going to do with your PhD that you couldn't have done with just the master's degree? Or were you running away from the industry?
Right, exactly. The industry was challenging, but I couldn't get to a point of making very critical decisions because I was still basically a worker with higher education. But once you're a PhD, you get a little more control to express your ideas a little more to people, express your creativity, and in potential be a manager and maybe even a president. And so I thought these possibilities were worthy of taking. So that's why I came back.
Absolutely. And the time really flies on this show. You look up and so we've only got a few minutes left, but I do want to ask you, because we promised our viewers, Francisco talked about funding and the way that graduate education is funded. And can you share a little bit about how your graduate education is being funded? Because I know that there are opportunities for students to get fellowships and scholarships and that type of thing. And you're working with Francisco. That's part of the mix as well. Can you share a little bit of that?
Yeah, so, actually the funding, I have one funding called Diversity of Fellowship in a DFI, Diversity of Faculty in Illinois.
Right.
And this is a 4-year fund for PhD students. It's 2 years for master's students. I have the PhD version. I get a salary or a stipend of $1,500 a month for 10 months. And my other funding I get is I'm a GA for Francisco, where I'm working in the recruitment department, helping to recruit UHB graduate students, specifically African American, Latino, and Native American students. And so with the combination of those two fundings have really made my life very good. I've been able to focus on my work, my research work.
Right. And that's a very important point that we want to make sure that all of our viewers and our listeners are aware of, and that is, if you really are interested in pursuing advanced degrees, and especially if you're a student of color, there are opportunities to have your education paid for and to even be paid to engage in your education. You're so needed. We so desperately need students of color to become professionals of color, to become educators and knowledge creators of color, that those opportunities are absolutely out there, and folks should be pursuing those. Michael, thank you so much for spending some time with us today. We really appreciate your time, and you're doing some pretty incredible things. Perhaps we'll have an opportunity to bring you back sometime and share some more about what you're doing over the next couple of years while you're still a student here.
It was my pleasure, and thanks for inviting me.
And thank you for joining us today. Once again, I want to share with you this information. It's information on how to contact the Urban Health Program should you have specific questions about anything that we've discussed today, about financing a graduate or a health profession's educational career. We've got folks here that can talk to you about that. Certainly Francisco can help you with that. If you've got questions about any of the health sciences, if you're interested in pursuing any of the health sciences, you can visit our website. That's the website address there on the screen. I'm not going to try and call it out. Or you can call our office at 312-996-7727, and we'll share information with you about ways that you can engage the Urban Health Program and the University of Illinois at Chicago to make sure that your health care, that your educational goals are met. Be sure to join us again next week. We'll be speaking with probably another outstanding student and talk about another potential health career that you might want to pursue. But join us next week here on the Urban Health Hotline. For the University of Illinois at Chicago, I'm DJ Wells. Thanks for watching.